I remember one day in December 2000. I was standing in a hotel exhibit hall in Vancouver at the annual meeting of the Canadian Psychiatric Association. I was standing in front of our poster showing the effective treatment of bipolar symptoms in a group of adults who had taken a broad-spectrum micronutrient formula. And by micronutrient, I mean minerals and vitamins. By the way, the data from that poster went on to become the first peer-reviewed publication of this novel treatment and was published in the prestigious Journal of Clinical Psychiatry. So I was standing in front of the poster, and along came a psychiatrist, a rather tall man from Alberta, who read the poster, and then he found the list of micronutrients on the side of our poster and started to run his finger down the list, bending over and peering each one. And I remember as he got to the bottom, he said, "Which one is the important one?" Well, I was dumbfounded. I didn't know what to say. Was it possible that an educated physician like this didn't know that our brain is dependent upon a broad array of micronutrients for optimal neurotransmitter function? You see, sometimes it seems to me as if everyone has their kind of own favorite list of trendy micronutrients, ones that they think are particularly important. So this year, vitamin D is very trendy. Last year it was more the omega-3s. Next year I'm predicting it might be magnesium. And vitamin D is important, and omega-3s are definitely important, and so is magnesium. But so are the B vitamins, and so is zinc, and so is calcium. And in fact, a broad array of micronutrients are essential for optimal brain function. As a matter of fact, our brains have evolved to need at least 50 micronutrients every day and in balance. So in other words, what I should have said to that psychiatrist was, there is no one important nutrient. Little did I know in 2000 that we scientists trying to evaluate the potential benefit of formulas with multiple nutrients would have a huge struggle trying to obtain research grants, because grant reviewers always asked us that same question: which one is the important nutrient? Even now, years later, grants go to people who want to study one nutrient at a time. And when my colleagues and I apply for grants in several different countries, we are told by grant reviewers sometimes, study one nutrient with this design and we'll be happy to fund you. So that's how granting agencies work. We know that now, but that's not the way the brain works. In spite of the lack of funding to investigate the benefit of broad-spectrum micronutrient formulas, my colleagues and I in Canada, New Zealand, and the United States have made a lot of progress over the years on shoestring budgets. And I'm pleased to tell you there are now more than 25 peer-reviewed articles in medical and scientific journals showing these benefits for people with a variety of disorders. Problems like mood and anxiety disorders, ADHD, as well as psychosis and substance problems. However, we need more research. I myself have seen micronutrients work in really profound ways. For instance, I saw and helped publish a case of a young boy who became completely well on a micronutrient formula after having been plagued by hearing voices, seeing things, delusions, obsessional thinking, and who had received conventional care and every kind of medication you can think of. And by the way, he is still well on micronutrients now, which is more than 5 years later. In another young boy, I saw complete resolution of a very intense problem of obsessions with guns, which, as you can imagine, was scaring his family quite a lot. I could give you so many more examples because there are hundreds of other or thousands of other stories like this. But they need to be verified scientifically, which is challenging when there are insufficient research funds. And finally, there's one more important fact that tipped the balance for me. Right now, we are losing excellent scientists who want to study this topic, but who leave the field because they cannot find money for their research. And so after watching my junior colleagues turn to other research topics because they have to fund their research careers, I have decided to enter the field of philanthropy. In Canada, with the help of a very large, respected community foundation called the Calgary Foundation, I've established a fund to support research and programs on multi-nutrient treatment of mental disorders. To locate this fund, please click on the website in my emails if you've received any of them, or go to the calgaryfoundation.org, which is the website on the bottom of your screen right now. When you go to that website, click on the word Donate in the upper right-hand corner, and then click on Select from All Funds. There's a search field, and if you put the word nutrition in that search field, you will find this fund. Thank you very much.